Hello, everyone, and thank you for joining June's Clinical Education Series presentation. Today, we'll review Igalmi, a sublingual dexmedetomidine film, and discuss how it fits into the outpatient management of acute agitation associated with schizophrenia and bipolar I or II disorder. This session will focus on clinical trial data, dosing and administration, safety considerations, and how this medication may be relevant in outpatient behavioral health settings, including clinic-based or supervised environments. My name is Shannon Thompson, and I am the Program Design and Implementation Specialist here at Genoa Healthcare. As a pharmacist, I collaborate with various teams across the enterprise to create and structure programs that optimize medication therapy management, patient care, and pharmacy operations to ensure the successful implementation of new business initiatives. My role involves not only designing and launching these programs, but also tracking key performance indicators throughout their duration to ensure they meet our strategic goals. By leveraging my expertise in pharmacy and program management, I help to drive innovation and efficiency within our organization, and I'm pleased to present this topic to you today. Our agenda for today will include the clinical challenge of acute agitation, providing a description and background on the new product, Igalmi, review its mechanism of action, dosing and administration. We'll take a look at its clinical efficacy proved in pivotal trials. We'll review safety and tolerability overview, key warnings and monitoring, as well as an upcoming label expansion for the product. Acute agitation is a common and often unpredictable challenge in behavioral health. Episodes can escalate quickly and may pose safety risks for patients, providers, and caregivers. In outpatient settings, the goal is often to calm the patient while preserving engagement and avoiding escalation to emergency or inpatient care. Historically, treatment options have been limited, frequently involving injectable medications or agents associated with high levels of sedation. These approaches may not always align well with outpatient workflows or patient preferences. This video provides a brief overview of Igalmi and its role in the management of acute agitation. As you watch, focus on how Igalmi differs from traditional approaches and where it may fit into real-world outpatient or facility-based workflows.
In acute agitation, sympathetic hyperarousal can feel like a knot that won't untangle. For patients with schizophrenia or bipolar disorder, this jagged tension can escalate fast, requiring a swift, dignified intervention. Meet Igalmi, the first and only orally dissolving sublingual film indicated for acute agitation that empowers patients to participate in their own de-escalation. Administration is simple. Under your supervision, patients self-administer the film sublingually or buccally. And the mucoadhesive film is designed to prevent cheeking, spitting, or swallowing. As an alpha-2 receptor agonist, it targets the locus ceruleus to block norepinephrine release, a key mediator of hyperarousal, calming without being overly sedating. Igalmi works fast. Clinical trials showed significant agitation reduction in as little as 20 minutes. Monitor vital signs and alertness post-dose for hypotension or bradycardia to prevent falls and syncope. Igalmi is not a controlled substance. Igalmi, empowering de-escalation with the speed of a sublingual therapy. Log into your distributor portal and select Dropship to order, or contact BioXcel Therapeutics to learn more.
Igalmi is an FDA-approved medication for the acute treatment of agitation associated with schizophrenia or bipolar I or II disorder in adults. It contains dexmedetomidine, a selective alpha-2 adrenergic receptor agonist, and is delivered as a sublingual or buccal dissolving film. Importantly, Igalmi is administered under the supervision of a healthcare provider, which fits clinical settings where monitoring is available. The formulation offers a non-injectable option that does not rely on dopamine receptor antagonism. Dexmedetomidine works by stimulating presynaptic alpha-2 adrenergic receptors in the central nervous system. This leads to reduced norepinephrine release and a calming effect on agitation. Unlike antipsychotics, this mechanism does not involve dopamine blockade, and unlike benzodiazepines, it does not act through GABA pathways. The clinical goal is rapid calming of agitation while allowing patients to remain arousable and interactive. Igalmi is available as a 120 microgram and 180 microgram sublingual film. Films may be cut to allow for lower doses of 60 or 90 micrograms, which is particularly relevant for geriatric patients or those with hepatic impairment. Dosing is guided by agitation severity and patient characteristics. If needed, up to 2 additional doses may be administered at least 2 hours apart. Importantly, Igalmi has not been studied beyond 24 hours from the first dose, reinforcing that this is for acute episodic use and not for maintenance therapy. Igalmi's approval was based on 2 randomized, double-blind, placebo-controlled phase 3 trials in adults with schizophrenia or bipolar disorder. The primary efficacy endpoint was improved in agitation as measured by the PANSS Excited Component Score. Both the 120 microgram and 180 microgram doses demonstrated statistically significant reductions in agitation compared with placebo. Notably, separation from placebo was observed as early as 20 to 30 minutes, underscoring its potential role in acute episodes. The most commonly reported adverse events in clinical trials include somnolence, oral hypothesia or paresthesia, dizziness, dry mouth, hypotension, and orthostatic hypotension. These effects are consistent with alpha-2 agonist pharmacology and are dose-related. QT interval prolongation has been observed, so patient selection and medication review are important. Overall, safety findings emphasize the importance of supervised administration and monitoring of vital signs. Igalmi should be administered in a setting where blood pressure, heart rate, and alertness can be monitored. It should be avoided in patients with significant hypotension, advanced heart block, severe ventricular dysfunction, or known risk factors for QT prolongation. Due to the risk of somnolence, patients should be advised not to drive or operate hazardous machinery for at least 8 hours after dosing. These considerations are particularly relevant when planning outpatient workflows. BioXcel Therapeutics has submitted a supplemental NDA to support administration of Igalmi in the at-home or outpatient setting. The FDA has accepted the application and assigned a PDUFA target action date of November 14, 2026. While Igalmi is currently administered under provider supervision, this ongoing review reflects growing interest in expanding options for outpatient management of acute agitation. Until any label change occurs, providers should continue to follow the current prescribing information. Thank you so much for tuning in to today's monthly educational series presentation. If you have any questions on today's presentation, please feel free to reach out to me at my email address listed on the slide. Our next topic will be covering Genoa Clinical Service programs, including prior authorization resolution and Genoa Savings Connect, presented by Genoa's subject matter experts. More to come next month. You can find previous educational presentation recordings on our Genoa YouTube channel at www.genoahealthcare.com/center-partner-resources. Thank you and have a great day.